We all know the importance of effective communication in our daily lives. But when supporting communication within dementia practice, this can sometimes be really tricky. The words we say and how we say it can have a lasting impression. It can be the difference between engaging with a person and not. But more importantly, good communication allows for connection. It helps us to build trust, and we can be more efficient and effective in the way in which we support people living with dementia. A few helpful hints for best practice communication. Patience. Although at times this may be really, really difficult, it's important to be as patient as we can. We need to give the person living with dementia the time and the space to process information and the time to respond. This is vital. If we rush or react too quickly, this will often lead to feelings of complete frustration and sometimes disengagement. Maintaining eye contact. Although this seems really obvious, it's important to understand just how looking into someone's eyes makes them feel safe, reassured, and understood. If the person is seated, it's important that we get down to their level when we're communicating. This can help maintain the person's attention and convey your interest in what they're saying. Visual prompts. This is really important when we're supporting a person with dementia. If the person is finding it difficult to communicate their need, a visual prompt may help this. And we see this within a number of different environments. What we should always remember is that each person living with dementia is unique, and communication strategies should be person-centred and tailored to their specific needs. When we think about communication in our daily presentation, we know that often a person living with dementia's presentation may change on a daily basis. But what we need to remember is there are always reasons for this. Usually, a person will try and communicate to us a specific need. If we can't meet that need, or the person living with dementia feels that we are not meeting that need, this is when we will see things like frustration, anger, sadness. So what can we do to support? We need to know as much about the person as possible. We need to know their likes, their dislikes, their wishes, what upsets them, what makes them happy. This then allows us to be very specific and very person-centred in our approach, helping the person and supporting them in their daily life.